Welcome to the Justice Journal podcast. I'm Sacramento County District Attorney Anne Marie Schubert. I hope you enjoy this podcast series where we discuss important public safety issues and provide insight into who we are as an office and what we do both in the courtroom and in the community to provide the highest level of public safety through prosecution, prevention, and innovation.
Thank you for joining us for this podcast episode. Today we're going to discuss a serious public health and safety issue, which is vaping, and specifically vaping among youth. We have several guests joining us today, so I'm going to ask if you can please all introduce yourselves and give us a little bit of your background and what your current roles are. So I'm going to start with D. Schubert.
Sure. Anne Marie Schubert, District Attorney, Sacramento County. I think most folks know me, been prosecutor my whole life.
I'm Dr. Tiffany Heckendorn, and I am a pediatric resident at the UC Davis Children's Hospital.
Karina, Talamantes, trustee for the Sacramento County Office of Education, and I was a former counselor working in our Sacramento high schools for about 8 years prior to running for office.
Great. Well, welcome, everyone.
Thank you.
Thanks.
Anne Marie, I'm going to start with you. So you felt it was very important to do something on the issue of vaping and youth vaping specifically. Can you sort of just start us off by talking about your main concern and why you thought this was so important to do?
Well, I think most folks that hopefully know our office and know me is that I have taken a very active interest in how we can prevent harm in our community of kids, really, that we need to do everything we can to raise healthy children because it affects every aspect of life. And so many of us, just even on our floor in the DA's office, we all have kids. And I have kids that are, teenagers, and I have a younger child that's 11. And you hear these stories about what's happening actually in schools right now. I mean, when I have an 11-year-old who's telling me, how there's nothing wrong with vaping and kids are vaping in class or those of that magnitude, and then you start to understand this is a whole new area and the dangers that it presents for children, and you educate yourself on this particular topic. I just felt strongly that we should bring our partners together because it all intersects, whether it's healthcare, whether it's the education system, whether it's public safety. It is all ultimately about the safety of our kids in our community. So that's why I felt strongly, and we all know it's probably one of the hottest topics right now across this country.
Absolutely. Before we dive into some of the specifics, I just want to ask everyone's opinion on why you think vaping has become so popular so fast, especially among kids. I mean, does anybody have any thoughts on why you think that is?
Yeah, I think part of the problem is that it's marketed as something that's fun and tasty, and I know that's changing, which is fantastic, but not too long ago, a lot of the flavors that kids could get were bubblegum, cotton candy, Cocoa Pebbles, and these are things that sound super appealing to kids, and studies have shown that most kids start using electronic cigarettes on these flavored products. So I think that was a huge issue.
Yeah, likewise, e-cigarettes come in many shapes and sizes. Sometimes it's hard to determine whether a student has an actual pen or if the pen is an e-cigarette. Mm-hmm. A lot of students are, accessing them, buying them from stores online, and they're easily accessible to our students. And well, they're harmful. Most e-cigarettes contain nicotine, which is highly addictive and can harm brain development, which continues until the age of 25.
So easy to hide. Easy
Yes.
for them to hide and do anywhere, basically.
I think one of the things that I was somewhat shocked at when I was doing actual research myself, just to educate myself, both as a parent and as the DA, of what these e-cigarettes contain. I mean, one of these e-cigarettes can basically, it's like smoking an entire pack of cigarettes. Yes. And that's like, oh my God, could you imagine? Because these kids, we hear it from my colleagues, these kids are doing it in class. Mm-hmm. And because there's no smell to it,
they can hide it.
They can hide it. And then I'm thinking to myself, could you imagine a child that is smoking the equivalent of a pack of cigarettes in a classroom or wherever they are, in a park? And then to add to that many of probably the black market ones contain marijuana.
Other things.
So
right.
That's the bigger thing for me.
Yeah, and I think it's easy for students to be able to hide these devices in their packets, and it's hard for school administrators, counselors, and staff to keep track of when a student goes to a bathroom and to be able to detect whether they're smoking on campus.
Right. Anne Marie, can you talk generally about some of the laws around youth vaping?
Well, it's interesting because, I mean, obviously I had to educate myself even more so on the specific to this. So the laws on vaping fall really under the tobacco laws. So it is not, unfortunately, it's not illegal for a minor to just simply possess an e-cigarette. It is illegal in particular areas, whether it's on a campus, whether it's near a school setting, whether it's near a park, things of those nature. So it is, that's not, it's not illegal simply to possess it. It is illegal basically under the no smoking areas. So where kids can get into trouble, other than the health concerns and the impact on their education, is when they're in one of those no smoking zones and they're doing this. And so there's kind of a couple avenues. One, they can be held accountable through city code ordinances or county code ordinances, which can be fines and things of that nature, which I'm sure that they can go up and up and up with those fines. I think from a student's point of view, where I'd be more particularly concerned is if I get caught at school, the school has, each district has the authority to regulate how they monitor their students and the discipline, and I'm sure Karina can talk more about that. But I think that in the next year or so, because of the significant impact we're seeing across this country, that there will be amendments to our laws about what can happen if a student a minor is caught with these. And, and I'm just going to give an analogy. If a minor is caught with alcohol, or they're driving under the influence of alcohol as a minor, then there's some authority to take either to delay their license, driver's license, or to suspend it. And that's a big consequence for kids.
Oh, yes.
So I would not be surprised if that at least is advocated for, because, the reality is, I know this from my own kids, is that if you don't have consequences, there's no reason not to do it.
Right.
And so the biggest, most important thing for many kids is their driver's license. And so I wouldn't be surprised if an effort is made, whether it happens or not, that the student's license can be delayed. So, but the laws it depends on the city, the county, and ultimately each district has the authority to regulate what happens on their campuses.
So in your mind, the laws need to be strengthened in some way, where there really aren't really laws.
I think that we need to have some impact to demonstrate to students and youth that it's really dangerous to do this on your health and well-being. Mm-hmm. So that's where I think is the concern.
And we're going to dive into the health issue. But Karina, can you talk about, so what can happen if a student, and I know every district is different, but can you give us some examples of some penalties or some consequences that the schools can impose if I would assume it'd have to be they'd be caught on campus vaping?
Like our DA, Anne Marie, just said, vaping is similar to tobacco in terms of the consequences. I think that it's still a fairly new concept, or it's still something new that we're working with, all the different school districts. I know Galt Elementary, Natomas, Robla, Sac City, Elk Grove, all the different school districts are starting to take note on the harmful effects of tobacco and flavored, the e-cigarettes, just because I know it, went for sale in 2015. And then as of December 2017, Juul is a top-selling e-cigarette brand in the United States. And, it's hitting and targeting our classrooms, our students in our schools, in our bathrooms, they're utilizing it on campus. And I think that we need to have collective action countywide to raise public awareness and share resources on how to address this. Just because every single school district has its own policy, and there hasn't been anything done formally to say, hey, this is how we're going to collectively address this.
But those conversations are happening.
Yes. Okay. Those conversations are happening, and the Sacramento County Office of Education printed out hundreds of educational posters in English and Spanish that were distributed to 60 Sacramento school campuses with information about vaping effects and products. Mm-hmm. And anytime we see facts in regards to tobacco-flavored or e-cigarettes, we distribute information out to our families.
Okay.
So last week, we sent the following information to our families. At least 21 people have died from severe respiratory complications associated with vaping, and at least 1,080 cases have been reported across the states, and 2 deaths have been connected to marijuana products, and reports linked marijuana vaping to over 70% of the lung illnesses being reported in the wake of the vaping epidemic. So we're sharing facts, and we're sharing resources, and we have different clubs like Friday Night Live to help bring awareness to this issue.
Dr. Heckendorn, I'm going to bring you in at this point. Can you explain how vaping, in terms of how it's inhaled and processed by the body, how that's different than traditional smoking with the electronic? I'm not sure if people know exactly how that works.
Yeah. So I think what's first and foremost really important to make clear is that both vaping, just like traditional cigarettes, you're going to inhale nicotine and all these other harmful chemicals that are ultimately bad for your lungs. It's a little bit different in that vaping, you're heating up this chemical solution, which is in like the pods that you buy. And so that solution is then being aerosolized and going into your lungs, which is a little bit different than the burning reaction in a traditional cigarette. But I don't think we have a complete understanding of what chemical reactions are going on in the body and how they might be a little bit different, although it is ultimately a small different process that's going on. But it's still extremely harmful, if not in some cases more so, to your lungs because of the bioavailability of these nicotine salts that are in the liquid cartridges.
Do you think that's why it's more potent?
It certainly could be an explanation of partially why it is more potent.
Okay. I think we've all heard in the news some of the health consequences to whether it resulted in death or lung injury. But can you, in just general terms, talk about what medical risks and the impact on health that we know of, and especially among youth? And to add on to that, how it might, or if it does, impact youth more than adults, just because obviously they're younger and they're...
Yeah. So there have been a lot of studies that kind of look at what not only the nicotine, but the other harmful components of vaping does to a youth's brain, essentially. And the reason why it's so bad for them is because brain development continues, as Karina was saying, until about 25. Mm-hmm. So their brains are really susceptible. And it's been linked to ADHD, mental health issues like anxiety, depression, and then certainly lung damage is also something that we worry about, and long-term nicotine addiction. A young brain is much more susceptible to developing addiction than an older brain. So kids getting linked to these vaping type devices early on puts them at a lot higher risk of developing nicotine addiction for their whole life, and ultimately transitioning to using like traditional cigarettes, which I think most everyone nowadays realizes are really harmful. It's just getting everyone to realize that vaping devices are just as harmful.
But originally when they were marketed as, this is better than smoking. This is safer. It's not as addictive.
It's a way to get off smoking.
Right.
I think I've
That's
seen
how
that
they market it.
argument.
Yes,
Yeah.
absolutely.
Yeah, there was actually recently a really interesting journal published in the New England Journal of Medicine that looked at using, and this was in adults, but looked at using vaping devices to quit smoking. And it just didn't show any long-term benefit of people quitting smoking. In fact, the people who use electronic cigarettes ended up being stuck using electronic cigarettes long-term, whereas the people who use traditional things like lozenges and patches actually quit smoking.
Right. Do we know if vaping is more addictive than traditional smoking? I don't know if that's something that's known at this point.
Yeah, so I don't think we have an answer to that yet. We know that both traditional and electronic vaping gives you nicotine, and it's incredibly addictive. But I don't think that we can necessarily say that it's more addictive one way or the other.
So the information that is known medically, are those being shared among UC Davis health professionals and within the medical community? So I'm wondering what conversations are happening in the different healthcare systems, and if whatever's being discovered, which I understand we're learning every day, how that's being shared and how that's being sort of used in practice.
Right. So I think more and more, as we're starting to learn more, they're really starting to try to make sure that all healthcare providers are kind of up to date on this topic. Actually, just this week, I just received an email from the California Medical Board talking about the California Department of Public Health's current stance and how they're really urging everyone to stop using vaping devices until we learn more, because they're just not safe. The American Academy of Pediatrics, which obviously just applies to pediatricians, but they release information all the time about what's kind of new on this topic and what pediatricians can do to kind of help screen for this in their clinics. The CDC is always putting out, I think every Thursday, they put out the newest findings in the ongoing investigation about electronic vaping. So there's certainly a lot of information that's starting to really be dispersed, as I think we're realizing that this is such a huge epidemic and kind of everyone needs to be on the forefront of fighting this.
So it's on high alert for everybody.
Absolutely.
Okay. And then Karina, in the schools, do the schools report if kids come into I don't know if there are still nurses that are on campus or when I went to school, any kids are coming in with any sort of health issues that might be identified as vaping related on campuses? Are you aware of any of that? No? Okay.
Can I just ask maybe a follow-up question to Dr. Heckendorn? In terms of the deaths across the country, and I think I may have heard this, is there a linkage to where there's actually THC in these e-cigarettes? So how do these kids get their hands on these types of products? Because I'm sure that it's not Juul that's selling the ones that have THC in them. So how do kids get their hands, and maybe you know, Karina, how do they get their hands on e-cigarettes that actually contain marijuana, or THC, I should say?
I wonder, is the thought that the students are getting these substances, liquids, from not the traditional retail stores,
Like a black market kind of thing.
I mean, how? And so is it? I don't know. Is it sort of like the same thing as like a drug dealer? Like someone knows someone who knows someone. I mean, it's a good question because.
And I've seen a couple different studies that have kind of looked at this, and often the answer is, I got it from someone else. So they are, there are some people, whether they're buying them online, and then everyone's kind of sharing. And so I think it is kind of like this black market type, what you're describing.
Right.
And you had asked about a lot of these injuries. Are most of them related to these marijuana cannabinoid type products? And we've seen it in both the nicotine-containing vaping products and also the marijuana ones.
Are they mixed though, or is it one or the other?
So I think traditionally, I can't say for sure. I think oftentimes it is one or the other.
Okay.
But we have seen that a lot of the injuries have been from these products that contain marijuana in them. And I think just the California Department of Public Health said just in California since June of 2019, there's been 102 cases of the vaping-associated pulmonary injury.
What's just from a health point of view, can they recover from that? How do their lungs, I mean, I know people say their lungs are now like a 70-year-old, when they get off the vaping and then they start living a healthy life, can their lungs recover?
Their lungs can recover, but it's obviously extremely dangerous. As we were saying, people have died from this. And obviously damaging your lungs when you're young is terrible because, you want to be happy and healthy and be able to grow up, as you were saying, that's so important to keep kids safe. But I think part of the problem in even just recognizing it is that oftentimes the first symptoms aren't lung related. So the first symptoms that a lot of kids or even adults will report is like nausea, vomiting, just feeling really fatigued. And then they start to show some of the more lung symptoms, chest pain, coughing. And so it can be difficult to even know at first that the symptoms are from the products that they're inhaling.
Do you know what the timeline is? So how quickly from those first symptoms to when, they know there's a respiratory issue?
So the problem is that to call it a vaping-associated pulmonary illness, it's really a diagnosis of exclusion, which just means that we kind of have to rule out all the other things, saying, okay, this isn't the flu, because obviously these symptoms that we're talking about can sound very much just like a common viral illness, that this isn't some sort of bacterial pneumonia type infection. Like we have to kind of rule out everything else. And then if they are using these products, they're having these symptoms and we can't find another source, then we can say it's a vaping-associated pulmonary illness.
Okay. Do you and or other medical professionals have your own opinions on what it is that is causing the injuries or the deaths? I mean, do you have any kind of theory from what you know at this point, or is it still just every case seems to not be exactly the same?
Yeah, we still don't know exactly what's causing it. But again, we know that these products have so many harmful chemicals that are on, California's prop list of all the chemicals that can cause cancer, birth defects, brain damage.
How does it get on the market? I don't understand.
And
A lot of lobbyists.
and we know these products are in these vaping devices. So I think, we've all said here, just making sure that everyone knows that these aren't safe alternatives to smoking. There are tons of harmful chemicals. There's nicotine, and that's just not a safe thing for anyone to be using, especially young people.
Kids. Right. What have you seen or have you heard of that UC Davis Health has seen come through locally, if that's something that you can talk about?
One of the interesting parts about being a resident is that we get to rotate in different parts of the hospital. So I've actually worked in the emergency room recently where I have seen quite a few patients come in, anything from being altered to where they can't talk and speak from vaping these different marijuana type devices, to young toddlers accidentally ingesting the liquid in these pods, which is incredibly harmful.
Oh my God.
So we're certainly seeing it in our community.
Wow.
You can look on Facebook, and it's pretty interesting to see this one image that's floating around on Facebook of a young woman in the hospital with breathing apparatus that just says, "I'm on the anti-vaping campaign."
So she's holding a sign
It's
up.
really shocking to see this young person in basically ICU.
Wow.
Yeah, I mean, people can end up intubated. So meaning there's a tube down their throat that's having to breathe for them because their lungs are so sick that they can't breathe for themselves. So this is serious when we're talking about these vaping-associated pulmonary injuries. What does that mean? It means your lungs essentially stop working and a machine may need to breathe for you.
How quickly, let's just say someone started vaping a week ago. Is that something that they just vaped too much one day and they're in the hospital the next day, or have they been vaping for a while, but a lot? How do they get to that point where their lungs are so injured?
Yeah, I think there are a lot of different factors. And, we talk about like this black market and all these different type of products that have who knows what mixed. I don't think there's any clear way to say, well, if you start vaping this product, in 1 month you may have this. It's different for everybody.
Well, obviously vaping is in the news, I think, almost every day. And it's created, as we've talked about, a big public health alert in I think, a fairly short amount of time. If you think about how long it took for tobacco, for the bells to ring on those. What is your reaction, and I guess all of your reactions, and the health community's reaction about just how quickly this is all happening and just the severity of it?
Yeah. For myself, and I would say for all the health professionals that I've talked to, I think we're all truly shocked. The CDC put out its 2018 data and showed that there are 1.5 million new youth users in 2018. And that ends up being about like 1 in 5 high school students and 1 in 20 middle schoolers, which is astonishing.
Wow. What's the reaction from school administrators, as far as you know?
So we're integrating vaping and tobacco into our curriculum system. We're embedding it in the Project Alert curriculum in the 7th and 8th grade and the Project Success at 3 of our continuation high schools. So we're trying our best to educate our youth at an early age about the impacts and the harmful effects of e-cigarettes.
So it sounds like the school administrators are also understanding that this is needs to be dealt with now and fast.
Yes. We're integrating it into the curriculum and just bringing more awareness. I know we have peer youth groups where they go out and teach other students about the harmful effects of vaping and tobacco. And sometimes that's the best way to reach other youth is through each other, word of mouth, and spreading that knowledge and having ambassadors on all our high school campuses and middle school campuses to let the students know about the harmful effects.
In our third part of this, we will have local high school students who will also talk from their perspective, and they're on the side of prevention.
Yes.
But it'd be interesting to hear to see what they're doing.
I think the other thing that we have to remember is that we as adults have to lead by example.
Yes.
And, you look to other states that, have similar situations like Colorado, and the number of high school students vaping is astronomical. And so, it may be legal for an adult to vape, but is it really a healthy thing to be doing in front of your kids? And so we teach kids that it's okay. It's almost like, you know, if we just sit and vape in front of our kids, they're going to learn that they can vape too. And they, you know, I've heard kids say, "What's the big deal, Mom? It's not big. They're just, everybody's vaping."
Right.
Yes.
And I think this shock and awe that we've seen in the last few months, I mean, I know my kids are like, "Oh my God, that's so dangerous," because of what's happening. And so there's been, I think kids are getting it because of the health concerns.
Right.
And so I think that's where we, as all different little silos that we have, come together and for the common good, which is ultimately the health and wealth for our children.
Yeah.
So speaking about adults, parents, is the medical community and then also school, are you hearing from concerned parents? Are they, whether it's patients coming in, are you hearing from adults who are concerned also about, you know, I know that the schools are sending out a lot of information, but I don't know if they're hearing directly from parents or adults.
We do have, you know, it varies. So the Sacramento County Office of Education provides support services and curriculum to our 13 school districts in the county. And so every single school district has adopted its own policy and its own, you know, kind of process of how they'll go about things. I know that one of our middle schools did have 10 parents at one specific school site that came in and said, "Hey, what are we doing in regards to vaping? I've been seeing it a lot here in the neighborhood. And what are we going to do to address it at a middle school, 10 parents?"
Yeah, and I think, you know, absolutely, parents are expressing to schools. Schools have reached out to UC Davis, and we've been trying to collaborate with some of the different schools in the area to do some presentations. I did one last year at a high school in Elk Grove, and the parents who came out to listen were all very concerned. They're like, you know, what are we doing to address this at this school, but also at the county level? So I think people are really starting to take notice and want answers on how, you know, we're kind of helping address this issue.
Right.
Yeah, the Sacramento County Office of Education does have a program for adolescents using substances. We have a 2 to 3 session intervention for students who vape or use other drugs. And so we have counselors that specifically go and talk to students about the reality and you know, what the harmful effects are.
And is that something that the students just go to on their own, or do the parents need to also be involved?
It would be just the counselors and the staff. Yeah.
Okay. What do you think would help parents, teachers, coaches, or any adult that works with youth to educate them and discourage youth from vaping? I mean, what advice would you have?
I mean, I think first and foremost, you really need to educate yourself on the topic, what these things look like. Like we've talked about, they're so small and easy to hide. And the first time I saw a lot of these products, I would have had no idea it was a vaping device. So that's first and foremost. And then I think just talking about it, I mean, we say that 1 in 5 high schoolers is vaping. That means even if your child isn't, you know they know somebody who is. They've seen it on campus, and just opening up for a conversation. And, you know, as physicians, I think we're starting to really ask, you know, in our well checks, we always ask about smoking and secondhand smoke. But oftentimes, if you don't ask specifically about electronic vaping, that doesn't come up because they just don't associate the two things together. So really starting to specifically talk to teenagers and their parents. You know, do you vape or Juul or use any of these products? And then also to address the secondhand smoke. Because as you were saying, you know, kids are sitting there watching their parents vaping, and the aerosol that's coming out is not just water vapor. It itself has nicotine and harmful elements in it that then kids are getting exposed to.
So there's a secondhand smoke factor just the way there is with traditional smoking.
Absolutely. And I think that is another one of the huge things that people don't realize. And so even if your kid isn't using it, if they're around friends who are, they're still getting exposed to those chemicals.
Right. When minors come in for a doctor appointment, I think, do the parents always come in usually, correct?
Typically. I mean, everybody is different, but one of the things that as a provider for our typically like kind of teenage age, so 13 to 18, we always have parents step outside the room. And we just make that very routine. Like, hey, for all of these visits, you know, would you mind just stepping out for a few minutes just so that I can, you know, talk to the patient? And it gives you the chance to really talk to the patient, hopefully.
Well, I was going to say, because were those kinds of questions asked?
Right. So those are questions that we ask during our confidential visit.
Okay.
And then afterwards, when I go back to get the parent, I'll often ask them, without their child in the room too, like, do you have any concerns that you wanted to bring up to me. And then, maybe that's the time where they say, oh, well, I'm worried they might be vaping, but I don't want to address it. Like, would you mind talking to them
It's just
about
a unique situation because I don't think minors are going to want to offer that up in front of their parents.
Right, absolutely.
But we got to know somehow.
Absolutely. And all the sensitive information, they don't want to talk about that in front of their parents.
Yes, that's true. What are your guys' thoughts on what else can be, what would your message be, or what else do you think we can be doing?
I think Karina's point earlier about the importance of bringing in almost a peer support program, because, honestly, do I think my kids are going to tell me if they're vaping? No, they're not going to tell me. They're probably not even going to tell me if their friends are vaping. But I do think hearing the real life stories from other people in similar age groups, whether they're 21 or 22 or, within a 10-year period of time, can be very impactful. And it's not just I know how my kids, it's just wah, 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 wah. They want to tune me out, right? Yes. But if they actually, if a 19-year-old kid walks into Sac City High School, maybe McClatchy, and says, here's what happened to me, and here's some photographs of me in the hospital, and here's what the impact and the real life consequences, then I think we can reach kids even more. So this is where it takes a village to really get folks together. Because I do think kids are waking up to the serious health implications. That's what I'm not sure they care much about anything else other than these health implications. They might care if they lose their license ultimately, but I think for now, realizing that their lungs are turning into the age of a 70-year-old, and seeing these images on Instagram or Snapchat or
these
whatever.
young people, yeah. Like when we were growing up, when it was the tobacco that was the issue, all the images we saw were 40, 50 years down the road. So I remember being at that age, I didn't even think about that. Well, that's later. Who's going to care when you're that age? But I think the difference is now, these are their peers who they're seeing. So it's very much an immediate thing.
Yeah, and I think, parents, educators, healthcare providers, and policymakers can collaborate and prevent and reduce the use of e-cigarettes by young people. Like you said, it takes a village. At our local school districts, I think our local school districts can develop, implement, and enforce tobacco-free school policies.
Okay.
And like I said, those support services and that education piece will always go a long way. The more people know, the more informed they are, the more facts and knowledge they have, the better they know to make the right choices.
I don't know if you can talk much about this, but I'm just curious because vaping is so easy to hide, and just hearing on the news how kids are able to find ways to do it without being caught. What are you hearing from some of the schools about? Are they implementing new ways of doing things to try to avoid having kids be able to sneak it in somehow, or is anything being changed? Because I know some schools across the country, they're making kids sign in before they go to the bathroom and sign back out, so they're always kind of monitoring where they have to be more than usual. I don't know if it's at that point yet here.
No, every school district has its own board that can implement the different policies. At the Sacramento County Office of Education, we provide support services and we provide those education pieces. We send out the newsletters, and we work with our legislators and our capital folks to see what kind of policies are being passed, and then we can implement them. Okay. But it is tough. Yeah. It's really hard. You don't know, with regular cigarettes, you can smell it, you see it, you notice it, and there's actual smoke. Yeah. And when I see a parent with smoking a regular cigarette with their child, I'm like, oh, and people look at you and they're like, okay, but with these new e-cigarettes, you don't know. Right. Someone could be smoking in a car with their newborn, with the child right next to them, and they don't know the serious health implications.
And the role modeling that
role modeling.
Mentioned.
So I think it's just really hard for school staff to identify what those vaping products look like, because like you said earlier, they're like gummy bears and sugar and peach, and they're different flavors. They're shaped in different sizes, and it's even hard for me to know what is a e-cigarette. I don't know. It could be this pen. It could be something. Right. I know there's like a sweater that you could wear with the hoodie with that you could pull it down and smoke, and it's embedded in the sweater. And so they're getting really creative in terms of marketing to our youth.
Yeah,
and clearly they're being impacted. And I think that we need to move this conversation along a little faster and bring more attention to this issue.
Right, because developing products where you can hide it, well, who would need to hide it?
Right.
A minor
Right.
would need to hide it.
Right.
But I think to your point, I agree with you that the first thing to do is to educate yourself, because you got to stay ahead if you can, or at least on top of what's out there, and be able to identify and take more of an active role in sort of watching what's happening in your own household. I think that's a good point.
And an easy way to do that, I mean, I just Googled
Yeah.
vaping devices and scrolled through pages and pages of what different things look like as like a first step. And okay, well, now I kind of have an idea what these look like. And then I started to notice them like all around. Oh, that's a vaping. Oh, that's a vape.
Yeah, I think that, in my opinion, the market branded it as it's not as bad as a regular cigarette.
Right.
It will help you stop smoking.
Yeah.
Step
It's
until you
not
understand
as
it.
bad.
It's not as bad until you read that the fact that one vaping cigarette contains basically a pack of cigarettes.
Right.
And that's, to me, there's two parts to it. It's the part for kids, youth, is education,
Yes.
right? That to provide prevention. And then there's this other piece of it, is that we need enforcement when we're dealing with these companies, whether they're legitimate
Yes.
companies or not, that we know they're marketing to kids. And
Right.
so we've got to have some kind of enforcement rules that allow us to prevent them from targeting youth. Because that's, I mean, honestly, the more kids they get addicted, the more money they're going to make.
Right.
Oh, yeah.
And so that's the
Right.
challenge we have.
And like Dr. Heckendorn said, they're going to make it for a long time,
Right.
because that addiction is going to last for a
Yeah.
long time.
Yeah, and they've made those statements without any scientific evidence that they're safer. And so it's just really frustrating that they can market, how they want without any scientific evidence to back it up.
I think that's part of the shock, is that what's happening? I thought this was supposed to be safer, and it's so much worse.
Right.
That, and it's just happened. So, I mean, and it's continuing to happen.
Right.
Well, is there anything else that anybody wants to share that we haven't covered?
I just think it's, I appreciate everybody coming today and just their willingness to do this, because it does require all different aspects of our society to come together, because at the end of the day, our kids are our future, and it's whether they're healthy, it's really dependent on all of us to work together. So I just appreciate you guys coming in today.
Like our DA Anne Marie said, our kids are our future. These are our schools, our Sacramento, our families, they're our students, and they're our future.
Right.
And we need to invest in them, which means that we, as leaders in the community, as parents, as educators, as staff, as custodians, coaches, I always say, like, every staff member at a school site can make a difference. If you're a baseball coach, soccer coach, it doesn't matter. If you set a positive example and you're a positive role model for your students, you can make a difference. And it's going to take all of us to really make this into a campaign of public safety.
Right.
And health awareness, just because we always discuss the whole child approach.
Right.
Do they have nutritional means? Do they have safety? So
Yeah.
it's going to take all of us.
Well, thank you, everybody. This was a great first part of the discussion. As I mentioned, we will have a couple Kaiser representatives to talk about what Kaiser's seeing in some cases that have come through their system. And then the third part will be our local high school students. So this is a good foundation to kind of jumpstart from. So thank you
Thank you
very
for
much.
having us.
Yeah,
Thank
thank you
you.
so much.
Thank you for listening, and I hope you enjoyed this episode. You can find all of the Justice Journal podcasts on our website at sacda.org, iTunes, Google Play, and YouTube.